All right. Well, welcome everyone. My name is Celia Durline. I am the Director of Admissions here at Marymount California University. I'm so excited to have you all with us today. Today, for this session, we are going to be hearing from Dr. John Alexander. He's the Department Chair for Natural and Health Sciences here at MCU. And I'm just going to turn it over to Dr. Alexander for a presentation, but please feel free to put your questions in the Q&A box. We'll have a little bit of time at the end for a Q&A. So Dr. Alexander, please take it away.
Will do. Okay, I'm John Alexander, as she said, as Celia said, and I'm the chair of Math and Science. Basically, I oversee the biology department, and I'd like to hear your questions. So actually, please put any questions you have in there as the presentation goes through. We want questions, so actually we want to know what you're thinking. So what are we about? Oops. Okay, let me get it to change slides. So what we have is we really have two programs, and we actually have another program, which is part MDS, which actually has some of our, we have biology, chemistry, and human performance in that program, which that is not its own bachelor's degree. You have to mix and match, but it's a good program. And so it's another option that people have. But what we have as basically the major programs is basically a Bachelor of Arts in biology and a Bachelor of Science in biology. And with those, you can actually do multiple things. And so I kind of want to point out that down here, it says that actually you have to continue on to physical therapy, medicine, and dentistry with a Bachelor of Arts. And down here, it also says that the BS continue and go to master's program, doctoral programs in biological science, medicine, and pharmacy. One thing I want to kind of address is actually that the degree you pick, whether it's a Bachelor of Arts or a Bachelor of Science, is really up to you. There's no real restrictions on which programs you have to, which programs will accept what kind of degree. The Bachelor of Arts gives you more flexibility in picking your electives. You have a little bit more flexibility in electives. And that's good for like physical therapy, because physical therapy requires that you take anatomy and physiology where the other ones don't. And so that's why we have physical therapy under Bachelor of Arts. So one program just gives you a little more flexibility. The other program is a little more rigid, but you still have a little bit of room for electives in either one. Okay. So the one thing I want to point out is actually we offer the Big Five, which we call it the Big Five because it's what's required for the MCAT. And that's biology, general chemistry, organic chemistry, physics, and math. So in math, we need calculus. Okay, so we offer those are there. You don't necessarily have to take, well, there's options in there depending on what major you want to do and what is your ultimate career choice. So, but we offer those classes and we have them, and it's part of the major. So you pretty much have to take them if you do a BS in biology. If you do a BA in biology, there's a little bit of nuance there that you can take a lighter course load. So that's kind of the difference between the two. We're providing you basically a nice foundation into biological sciences. And so we offer different things you can do. And basically one thing we do have is we have a lot of cures, which you may not know what that is, but that's actually curriculum, undergraduate research experiences. And so actually they're built into the courses. So, that's one way that actually research is built into your course, but research is, well, we'll come back to research in a little bit. But what are they doing in those cures? They're actually doing different things, like they are researching drugs for patients. Actually, in organic chemistry, we've actually had where they're looking at diabetes molecules and actually trying to look at molecules for treatment of diabetes. And we'll talk about that more in a second too, because I have that on the slide. Another thing I've had students do is actually we tried to build a 3D model of a protein because we wanted to look at how the protein and the ligand or the drug actually interacted together, which is important for drug studies. So that was one thing we actually did. Then we also have this multi-stage project that's going on. That what that actually is in organic chemistry, you make a drug. And you actually could make up to 4 or 5 different drugs in a semester because of the project we're on right now. And then in biology and in biochemistry and molecular biology, you actually go off and test the drugs and actually make sure that they're good, and then give us, and organic chemistry give us feedback and actually say, well, you know, it's a good drug, it's a bad drug. So then we can actually make more modifications to it and actually make it turn it into a better drug. Okay. We're also looking at an antiviral project, but that's in its infancy. And so it still has a lot of work to do. And so I'm not sure when we'll kick off actually making the drugs for antiviral. So, but with COVID around, that's one thing that I kind of went and said, well, maybe this would be a good thing for us to look at. And they're not that hard to make. So I want to skip that 4th one there because there's a reason for it, but I'll come back to it. And the other thing we actually looked at was actually carbon dioxide sequestering. And so this is this analysis of oxygen displacement. So this actually went 2 different ways, but in submarines and space capsules, you have to basically remove the CO2 from the environment for the astronauts to basically sit there and breathe. And so it's one thing we actually did, and we studied different ways of actually looking and pulling out the CO2 and refreshing the air in both submarines and space capsules. The other one where you turn your future business into a coffee substitute, I wanted to wait on that because the student that's pictured on this slide is actually the student who did that. So what she actually looked at was actually dates and turning that into like a coffee substitute. She let me try it, tasted more or less like coffee. And so it's kind of an interesting thing. I think it was also caffeine free. So it was kind of a good project. And she went on and, you know, basically explored that. Now she also is currently now going to medical school. So this student's now going to medical school. So anyway, so I don't think she's working on her coffee anymore. But, you know, it's a good project for her to actually do. And she got a lot of traction with it and actually got a lot of business out of it, actually. So, but this slide's about internships and careers. So actually, we want to talk about what you can do with the Marymount career or Marymount degree. So we have this All to See, which is a local program. It's actually, I shouldn't say local, it's an international program, but it's here local to Marymount. And so we've actually sent some interns down there. And actually they've worked with different things. And one thing they worked with was the Discovery Channel Swim Scientific Expedition, which is the 3rd thing down on the list. So let me get my spotlight. So it's this 3rd thing down on the list. And this was actually a person that swam across the Pacific, and it was to highlight his movement across the Pacific and actually what he saw and what happened to his body too. So there was a physiological aspect of the study, and then there was also a trying to draw attention to the Pacific garbage patch. And so it kind of had a twofold thing to it. So, but it was interesting that our students were able to do that. Center for Reproductive Health, they did go down there and actually do an internship, which is very interesting. The student told me some nice gory stories, but I'll kind of leave that alone for just a moment. And then precision medicine, neuroscience, again, that was something else the student went off and did. When you leave Marymount with your bachelor's degree, you're really qualified to be a laboratory researcher or laboratory technician, something in that neighborhood. So that's what these graduates went off and did. They actually went to LA Biomed and did some research at LA Biomed. Kaiser, they do need lab technicians there. So actually they went there and did that. Eisenhower Medical Center, same thing. In Genentech, which is up in like San Francisco, they went there and actually did research again. So, but they went there as a laboratory technician. Okay. So most people tell me when they come to Marymount that they want to become a doctor. And so, so we actually do have, our program is actually kind of geared to this, that actually we want to sit there and send you off to medical school. We want to send you off to the pharmacy school, dental school, and so forth. So that's really what we geared our program towards, is actually trying to get you guys off to these programs. And and we've had really good success with this. Actually, students have gone on. USC, currently we have 2 students that are actually doing dental school at USC. Loma Linda, I think it's a physical therapy student that's there now. Toro University is a pharmacy school. So actually that's one of our pharmacy students there. And there's more. I didn't list them all because I just listed these 3, kind of highlight them and say, okay, well, these are the people that went on someplace else. Okay. So, but you have other opportunities. The girl I highlighted a second ago and actually pointed out that she did the coffee research. She's at a school in the Caribbean, which she chose to go there, and she likes it. So anyway, she's having a good time there. If you're not aware, we actually recently remodeled our labs. And so if you guys have done any tours at Marymount, then actually they've probably taken you by the labs and actually shown them to you. But our labs were remodeled in spring of 19, so we have brand new equipment. With COVID, we didn't get to more or less use it for a year. So we have brand new fume hoods, brand new workstations, brand new storage areas. And so these things are all set up for you guys to actually use. And it's one thing I want to highlight that's different about our program is that we have an expectation that you actually use our equipment, which is unusual for a lot of colleges because actually we have an NMR and we expect you to run NMRs. And when I was an undergrad, I was handed a sheet of paper and said, okay, go analyze this NMR. And the school had an NMR, but they didn't let us touch it. And so anyway, FTIR, we have one of those too. And so again, we're expecting you to actually run it, and we'll teach you how to run it and everything else. And they're actually these 2 pieces of equipment are really easy to run. So it's not a big deal. Protein imager, we actually have that for protein analysis. So actually, and that's a nice, spectacular piece of equipment. And then we also have a cell analysis kind of growth area, which is actually a kind of couple, 2 or 3 pieces of equipment. It is a biosafety fume hood. It's a CO2 incubator, and it's the media area to basically keep that sterile and keep that clean. And so it's kind of a little area in the back of our lab that's actually kind of dedicated to cell analysis and cell growth. So, okay. So the other thing, and research is not required, but I kind of want to highlight this research because I get questions about this quite often. And people sit there and say, well, what can we do? What can I do at Marymount and what is happening here? So if you look over here on the right, this is actually our diabetes research. So these are thiazolene diones. That's what this molecule right here is. And that's a common structure that is found in diabetes treatment molecules that actually are out on the market right now. And so, but we chose to actually try to analyze this and see if actually one of these would be better than the other one as far as a drug. And 9 out of 10 of these were never made before. And so our students at Marymount made compounds that actually had never been made before, ever, or at least not documented, I should say it that way. So nobody's documented that actually they made them. And so that's actually a kind of a publishable result on its own to sit there and say, well, we have these molecules that actually are ready to be used in some other place. And so then it's up to a pharmaceutical company to buy this library from us. Or, well, the other thing we're into it is actually give it off to biology and have them use it to actually analyze it and see if they can do their own analysis on it to see if it's good or bad. So there's kind of a twofold thing to do with it, but it is something that possibly some pharmaceutical company would want to buy it. What we're going to switch to probably next year is an antiviral small molecule synthesis. And so actually this molecule down here, and I got to tell you, this is actually from, this is not what we're trying to make. This is from my research as I was a researcher at a pharmaceutical company. And so this is one of our studies in basically trying to make some antiviral stuff. And I do believe this was for HIV. And so, but this was actually something we actually researched there. And so the circles are the areas we were going to change. And so these were areas that actually different people were looking at and basically trying to modify them to turn those areas into a better drug for the ligand or for the receptor. So The other thing when you're talking about modern pharmaceutical stuff, if you have to worry about protein and receptor, or protein, which is the receptor, and how the ligand or the drug fits into it. So that's what this study down here is. And so this is actually looking at that and trying to go, okay, well, how does that fit in there? This is pretty complex. This is very advanced when you get into this. You definitely have to be very experienced with actually using the software to sit there and try to do this kind of study. So anyway, this is kind of very advanced, but it's something we have to look at to try to determine whether or not our drugs are going to fit in the receptor site the way we want them to. So the other thing we have going on is this is actually a Kevin Barnese project, which is actually one of my other chemists. And he's doing these manganese ligands, it's manganese. Manganese is used for oxygen transport in the blood. And so he's trying to use these to determine how they would benefit the manganese to move oxygen through the blood. Then on the biology side of the house, then we're actually still doing the protein ligand receptor study. So that's the same study as up here, but this is really one of those biochemistry kind of projects that really kind of transcends both fields. And then we are doing a huge project right now. Right now, we have a company that's actually taken our students and hired them to work for them to actually sit there and upgrade their product. And so our students are getting paid to do research in our labs. And so, so this is very kind of exciting for us because actually the students are in there, quite a few hours of the week, actually trying to take their product that's actually out on the market and turn it into it's listed as a device now with FDA, and they're trying to turn it into a drug. And so, and it actually isn't injectable. So actually it kind of more or less is a drug, but it's just not listed as a drug right now. So that's what that's what the company's trying to do, and they're using our students to do it. So this is kind of very exciting because now our students are getting paid to do research. And so this is something we want to continue. And I keep looking for partners of actually how we can get more students to do stuff like this. And we were lucky because of COVID with this one, because actually we had our labs free. In the future, I think it'll actually more of a partnership where we're sending students out to their lab. But this is something definitely that I'm excited about. And so bare fat analysis is something that comes from one of our biologists, and she's doing this bare fat analysis, and she's been doing it for years. And that's a study of how bears hibernate and what happens to their fat stores. So what you can think about this is actually for is weight control studies. So different things in that category, how do you actually sit there and keep somebody lean and trim and everything else? That's what this metabolism study is about. And so how does the bear actually metabolize stuff while he's going into hibernation? And then of course, here's the diabetes small molecule assessment that actually they're taking these and trying to assess and see how they actually work, okay? And whether or not they work at all. As we propose a drug, a chemist sits there and says, oh my gosh, I can make this drug and this is gonna be the bomb. This is gonna be great. But that doesn't mean it's real. That is a lie until it's tested. Now, if I have this receptor ligand picture here, I can probably get a pretty good guess, but that's a lie until it's actually tested. So until it's actually given to a cell or given to an animal or something like that and tested, it's really, we don't know really anything about it. So with that, are there any questions?
Thank you so much, Dr. Alexander. I really enjoyed your presentation. It's great to get our students excited about natural sciences. And for everyone, please feel free to use the Q&A box to ask your questions. I know one of the things that I'm most excited about showing students when they come on campus are our new labs. I was wondering if you could tell us a little bit about what is unique about the new labs and what can students look forward to when they come to campus this fall.
Let me go back to these pictures. So anyway, they're pretty much brand new, and they're ready to be used. I mean, they're really set up, and basically, and a lot of this stuff is done for your safety, which isn't so glamorous, but we have these nice fume hoods in here that are put in for your safety. And so, but they're nice. I mean, they're really nice. They actually, anyway, me as a chemist, I appreciate these more than anything else because, I mean, they actually have flow control and everything else. So as you lower and raise the sash, it actually changes the airflow, which is an extra added feature to protect you. These tables here are kind of cool too because they raise and lower. And so you can actually adjust them to your height. We keep the remotes in the instructor's desk so students don't play with them, but if you had a need to actually raise or lower those desks, you actually can. And then in biology, it's more of a fixed workstation, but those are very nice too. So they're really redesigned for actually better storage in our department. And so that's what we're actually seeing. And so, so this is really nice too, because there's tons of work area in here to actually do work on the bench. And so this is very nice, but, and I'd love for guys to come out and see them and actually explore and see what they feel like and do for you. Okay.
Great. I agree with you. And I did not come from the natural sciences myself, but even I can recognize and appreciate a brand new lab. So that is something that I'm always very excited to share with students. One question that has come through is, I don't have a very strong math or science background from high school. Can I still do well in this program, and what kind of support will I get?
So, support. No, so you don't have to be great. It takes work and dedication. We are talking about biology, chemistry, physics, and math, and so those are hard classes. I'm not going to lie to you and say, oh, it's easy. But it really comes down to your desire. If you want to do well, we have the program set up for your success. What we've done in different areas is like chemistry, we've actually added an extra problem solving session. So what that does for you is actually we have a place where you actually almost do homework in class, and actually you have the instructor to support you. And so whether we're talking about general chemistry or organic chemistry, we have that set up. And so we have, and it's the instructor doing it. So actually it's for general chemistry, that's usually Kevin Barnese. And he's there with you for 9 hours a week, which may sound like a lot, and it is, but 3 hours of that's really kind of lecture, 3 hours of it's lab, and 3 hours of it is actually this problem solving. And so, and the reason for the problem solving again is actually that we felt like students needed that support. And so they needed that support to actually do well in the class. And so then we could really kind of push that through and actually said, well, let's have this extra support for the students. And it's done by a PhD in chemistry, that's one thing that differs from us and like a Cal State and differs from us and like the UCs, because, and even some of the bigger private schools, they actually use TAs. And so that problem solving session and maybe even the lab would be covered by a TA. And in our case, it's the professor, so actually, and somebody very knowledgeable in the field. It's not somebody we're trying to train to do well. It's somebody we know that knows how to teach that is actually in those sessions. So, and then on top of that, we do have a learning support center, which is actually run more or less, the director of it is our librarian. But he actually has people and staff that he's hired to actually do this, but there's a learning support center too, that if you, for whatever reason, can't get in touch with your professor, either Kevin Barnese or myself, then actually there's this learning support that's over there. And so you can actually go to them, and there's actually, so there's one of the TAs over there, if we can call him that, his name is David. He's really good. He actually did all the chemistry and biology. And so, he's over there tutoring right now. And then we also have one of our former graduates that's actually was there tutoring this semester. And this girl that I pointed out over here was also tutoring over there last year. But now she's gone. So anyway, she's not going to be there anymore. But they were all really good, and actually the science and math, and actually were really good in actually supporting our students. So you kind of have multiple ways to support yourself, and it's just you need to seek out and grab that support and actually say, please support me. Both Kevin Barnese and myself are very receptive. All our chemists are very receptive. Let me change that. And even all our biologists are very receptive to helping you. And so office hours are very much encouraged. If you don't understand something, please come in and ask. We want to be very supportive, and we want to basically help you out. We've also adopted, a few years ago, we adopted active learning techniques. And so that's basically trying to get you to actively learn in the classroom. And so it's actually where you get more hands-on with the program. So we've done a lot of things to actually try to support you. And so anyway, so our goal is your success, and that's the goal of everybody in the department. And so we all want you to be successful.
Great, and that is a wonderful note to end on, Dr. Alexander. Really appreciate it. So we're coming to the end of our session. Dr. Alexander, can I ask you to move to the slide where you have your email address so that the students would know how to reach you if they have any questions?
Oh, absolutely.
That's one of the things I love about MCUs that are approachable, how approachable our faculty members are. So there you have Dr. Alexander's email address, and you even generously also provided your phone number. So if any further questions, please reach out. I want to thank Dr. Alexander for joining us today, and for all the attendees for all your great questions, and enjoy the rest of your day. Thanks, everyone.